things have changed in the past couple of years. And to continue that discussion now on the current state of the pandemic, really happy to bring in one of the good friends of the show, Dr. Ulysses Wu from Hartford HealthCare, the chief epidemiologist there, to talk more. And it's been a while, Doctor. Thank you for joining us again. How are you this morning?
Thank you for having me. Happy to be with you.
Yeah, glad to have you here. And I want to start by just asking what the single biggest difference is now compared to where we were 2 years ago. I got to imagine we were talking about those tools in the toolbox, the vaccines, the therapeutics. I imagine that's reasons number 1 and 2 right off the bat.
Absolutely. I mean, so we break it down and know exactly what we're better at. First of all, we're smarter at it. And by no means do we completely understand this disease. We're still going to learn a lot of things about this, but we're better at understanding the disease, the transmission, when to treat, what to treat with. And we've had more treatment options, whether it's what I call pre-exposure, which is the vaccine, or post-exposure, which is monoclonals and remdesivir and a lot of other medications. And so we're better amongst with a lot of those other things. But one thing we shouldn't discount, which is better, is that the virus itself, as you have alluded to, has changed as well. And because of that, we are seeing, I guess, less severity. Now, we should not rest on our laurels and say, oh, well, with each new variant that comes, it's going to become less and less deadly. We don't know that for sure. But right now, as you alluded to, less hospitalizations. Cases are still high to a certain extent, and that's a good thing in the sense that people aren't experiencing severe disease.
Now, I know you don't have a crystal ball, Dr. Wu, but a lot of people are looking forward to the point where this virus starts circulating endemically, meaning at sort of a consistent but usually fairly low level, like the flu does, like a lot of other viruses do. How close do you think we are to that point, and what is really going to decide when we're there and when we're not?
Yeah, so that's a good question, something I get asked a lot. So I'm about 50-50 where we are with that. And so we look at the cases in the United States, specifically Connecticut. They're getting better, numbers are down, though they're not coming down as fast as I would like them to anymore. But I think once the weather gets better, that's going to be okay. But we forget this is the pandemic, which means it's global. So we look at places in Southeast Asia, in Hong Kong. I'm sure in, unfortunately, Ukraine, cases are going to start going up as well. So we're going to start looking at the global sense where this disease is. And then don't forget, as we transition into the summer, the Southern Hemisphere is going to transition into the winter. And that's where we actually had the rise of the Delta variant that came out last summer. So if I had to look at my crystal ball, I'm hoping no further variants pop up. If they do, we would look for them to happen towards the end of the summer. If they don't pop up, then we would look for this to become more endemic, more seasonal around end of October, November this year.
And doctor, forgive me, this is going to kind of be a long question, but I think for most of the last 2 years, the public policy was geared just around optimizing public health. There were mask mandates, there were lockdowns, and for very good reason. We're not really at that point right now. We're at the point where politicians and public policymakers have other things to consider, that people want to live their lives without restrictions if they don't have to have them. So we're starting to see some tools being taken out of the toolbox. There's no more lockdowns. A lot fewer people are masking up. Of course, that's not necessarily the best thing for public policy. So how do we sort of strike that balance between what a lot of medical professionals like you, who might be a little more risk averse than the general public are, and strike that balance between that and then people who just want to live their lives as freely as possible?
That's the age-old question. And I always butcher this cliche. I can never get it right. I should probably look it up one day, but we don't want perfect to be the enemy of good or the enemy of progress. And so if we aim for 0 cases, we're never going to get to that point where we strike that balance with what is best for us from a social standpoint, from an economic standpoint, from a political standpoint. And so the balance is different depending on the tenor of the times. For example, let's look at gas prices as the analogy, right? So gas prices, we should be able to meet the product or the demand at this point, but because of everything that's going on, prices have shot up. So there is a perception, and that is the same thing with COVID as well. There's going to be a perception. And so, for example, we are up to almost 3%. 3% in terms of positivity rate. 3% 1 year ago, everybody would have been like, oh my my goodness, what's going on here? And now 3% is like, let's get rid of everything. Let's unmask.
Right.
And so perception is really dependent on the state that you are in. And I don't mean, obviously, geographic state.
Yeah, it's there's no perfect answers. I think the cliche you wanted was never let perfect be the enemy of good, or something like that. Either way, Dr. Wu, thank you so much. I'm not as good with it too. Thank you so much for taking the time to join us today to look back on the past 2 years. Of course, we will check back in with you again sometime soon.